Good, happy Wednesday morning, August 4th, 2021. I'm Riley King, and welcome to this morning news update right here on the Riley King Radio Network. Let's get started right now. First up, small number of breakthrough cases shows effectiveness of vaccine, doctors say. Let's take a listen to that video from WMUR News 9.
At Bell-Tape's, customers will find everything they need for a building project. The brand names you trust to perform. And with a fleet of over 50 delivery vehicles, we deliver when and where our customers need them. Bell-Tape's Building Products. 9 locations throughout New Hampshire and Massachusetts.
Challenge with Delta is that it's very, very easy to transmit. One of the concerns for all of us in healthcare is that even vaccinated patients can get Delta and can transmit Delta.
News 9 closely tracks the numbers reported by DHHS. On August 1st last year, there were 397 active COVID cases in the state. August 1st this year, 738 active cases. Current hospitalizations are up by 10 compared to this time last year. What doctors want you to know is the vaccine is the difference between getting COVID and possibly dying and getting COVID and getting a symptom like a fever.
We're seeing that with the Delta variant that the vaccines are still tremendously effective, but they're in about the 85 to 88% effective.
I went into orbit when I heard that I tested positive.
Elizabeth Murray is a fully vaccinated COVID positive person who says she fully believes the vaccine protected her from getting really, really sick.
I don't have any anger towards the vaccine. I know the vaccine is a preventative step. It's not a cure.
The stats tell the story. Since January 20th of this year, there have been 666 breakthrough cases out of more than 41,000 cases in New Hampshire, just 1.6% of all cases. There have been 10 breakthrough deaths out of the 361 total COVID deaths, or 2.8% of all COVID deaths. And doctors say that is a testament to the vaccine.
The population that is unvaccinated is the patients that are dying and being hospitalized, and getting vaccinated is the one thing that everyone can do to help mitigate this pandemic.
CMC sends a percentage of their patients' COVID specimens to the state for analysis, but tells News 9 the state will not confirm how many of the specimens come back as the Delta variant, citing a federal rule that prohibits it. We're live tonight, Amy Cavino, WMUR News 9.
Okay, there you go on that video and that report. DartmouthHitchcock Health to require COVID-19 vaccinations for all 13,000 employees. Let's take a listen to that video from WMUR News 9.
Whether you're planning a weekend in New Hampshire's majestic White Mountains, a hike up Monadnock, or a week-long stay in our picture...
Come September 30th, employees of the Dartmouth-Hitchcock Health Network need to be fully vaccinated against COVID-19 if they want to continue to work there.
All employees, all levels, remote workers as well.
Dr. Joanne Conroy, President and CEO, says there are medical and religious exemptions.
Just like the flu vaccine, we have a process that people can go through and apply for those.
Dr. Conroy says the decision is something they've been working on for some time, but a recent outbreak on Cape Cod and new data about the virus sped up that process.
Provincetown gave us really compelling evidence. There were close to 900 people infected. 74% of them were vaccinated. Only 7 people were hospitalized and nobody died. That's pretty impressive. So we learned a lot from that experience, and I think that tipped us into considering that to lead in public health, we really need to make it mandatory throughout our facilities.
As we've said all along, the vaccine is going to be the thing that helps us get out of this pandemic.
Steve Onen, president of the New Hampshire Hospital Association, says the group supports the decision, adding that other hospitals should do the same.
We think it's absolutely the right thing to do. Hospitals, the core of our mission is supporting patients and protecting the health and safety of our patients.
And the New Hampshire Hospital Association says it believes other hospitals will follow suit in the coming days or weeks. Reporting in Concord, I'm Tim Callery, WMUR News.
Okay, and there you go on that video and that report. UNH to require COVID-19 testing for all students and staff regardless of vaccination status. Let's take a listen to that video from WMUR News 9.
Okay, got everything ready. Got the rental, got it dropped off, going to the championship with your tiny champion. Going. Got it.
While state law prohibits us from requiring vaccination, I can't stress enough how important vaccination is for the health, safety, and yes, even the lives of our community.
In this video message on Facebook, the University of New Hampshire president tells students and staff that they will be tested for COVID-19 when they arrive for the fall semester, regardless of vaccination status. Through September, those who are vaccinated must get tested every other week. Students who are not or don't report their status must get tested twice a week, and once a week for employees who are not fully vaccinated or don't report their status. It means Emily Duffy, who commutes to UNH from Epsom, must get tested despite being vaccinated.
Well, at first I was a little bit miffed because, of course, it's annoying having to walk all the way to the mob and get testing, and then I remembered that at the end of the day, it just means that everybody in the community will be a little bit safer.
The university president says it's meant to keep everyone safe in light of the Delta variant, which in rare cases has infected vaccinated people and the uptick in cases across the country.
Anyone who's not vaccinated should follow recommendations by the Centers for Disease Control.
UNH will not require masks or physical distancing, and there will be no limits on gathering sizes inside or outside. UNH says it will test wastewater to help detect the virus at dozens of its campuses.
Okay, and there you go on that video and that report. One new COVID-19 death reported in New Hampshire as hospitalizations increase. Let's take a listen to that video from WMUR News 9.
Whether you're planning a weekend in New Hampshire's majestic White Mountains, a hike up Monadnock, or a week-long stay in our picturesque seacoast,
active cases of COVID-19 are back above 800 in New Hampshire.
Those are levels we haven't seen since May, and tonight the state is reporting 169 new cases, with current hospitalizations going up to 37. And there's one new death to report tonight.
There's also little movement on the vaccination front in the state. 58.5% of Granite Staters have now received at least one dose of vaccine, with 53.7% fully vaccinated.
Okay, and there you go on that video and that report. Vaccinations offered at Merrimack's National Night Out event last night. Let's take a listen to that video from WMUR News 9.
When it's time to invest in a new roof, be smart and look at more factors than just the final price. Not all roofs are the same.
Games, free food, and activities as the Merrimack community gathers for National Night Out for the first time since the pandemic started.
It's a good night for people to gather and socialize, and especially now, I mean, after the last year, people are anxious to get out and see people and interact, and so it's a good community building night.
More than 20 businesses and organizations put on activities and gave out free food and COVID-19 vaccines.
We made arrangements with the state vaccination van, and so they'll be down here tonight. with the Johnson & Johnson and the Pfizer vaccines available for people to get.
So I want to take the opportunity to allow people that haven't gotten a chance to get vaccinated at a central location like this to come on down. And the state's been gracious for us to be able to send a team down here for vaccines.
Chief Brian LeVake took over in the middle of the pandemic and says this national night out is important to connect with the people he and his officers serve.
That's one of the things, the regrets that we've had, is that we haven't been able to do these community projects and programs. So hopefully this year we're going to be able to gather again, see people, interact with people in person versus on the phone and computer. So hopefully it's a good turnout tonight, and the weather's holding out perfectly, so it should be a great night.
And multiple other communities held their national nights out tonight as well. Belmont also hosting a vaccination clinic. In Merrimack, I'm Charisse LeClaire, WMUR News 9.
Okay, and there you go on that video and that report. NYC to require vaccination proof for indoor activities. Let's take a listen to that video from NBC New York News.
Now, with a major development on the COVID front, you want to go out to eat or go to the gym? New York City is now going to soon require you to prove you're vaccinated. First in the nation. News 4's Gus Rosendale's live in Hell's Kitchen. And Gus, we've seen this in other countries, but how will this work here, and what's the goal?
Well, Adam, if you like to eat outside, like a lot of people here on the restaurant row, the rules don't change at all. But if you want to go inside, well, yeah, you got to show proof that you got the shot. Tyler Hollinger needs to make sure you're 21 if you want to drink at his Midtown East restaurant, Festival.
And for garnish, classic gooseberry.
And in a matter of weeks, he'll need to check for something else.
I noticed that the mayor did not say that you needed a vaccine requirement to get on a subway or a vaccine requirement to get on a bus.
But Mayor de Blasio's mandate, called the Key to NYC Pass, does cover a lot of territory. It launches August 16th and starts to get enforced on September 13th, the same week school starts in the city. Proof of vaccines needed for indoor dining, indoor gyms, and indoor entertainment and performances.
Because someone's vaccinated, they can do all the amazing things that are available in this city.
People will need to show one of those white CDC vaccine cards or use the Excelsior Pass or a yet-to-be-unveiled City Pass on their phone. Businesses that don't enforce the rules face fines. The City Hall says exact penalties are still being worked out.
So it is legally absolutely appropriate to move forward with this mandate, and it's necessary given the pace of the Delta variant right now.
The NYC Hospitality Alliance says in a statement, while having to require this requirement is far from ideal, now we need government to support restaurants, bars, and workers with clear and fair guidelines and an extensive outreach and education program, while also implementing more policies to support the industry's recovery.
In the same way that we take precautions to ensure food safety and other health and hygiene standards, that's what we will be aiming for.
But for Tyler, who opened his Second Avenue restaurant during the pandemic and built these cabanas under outdoor dining rules, these new vaccine rules are one more pandemic challenge.
To me, it seems like the government is trying to get around it by having small business do the enforcing that the government should really be doing.
And what do you do if you're a parent, you got kids under the age of 12 who don't qualify for the vaccine yet? Well, the mayor is hopeful that the vaccines will start to be available to kids ages 5 to 11. He understands, though, that still leaves some murky areas with this policy. He says he's working on those details with the restaurant industry. Hopes to have better answers. But, Adam, do bear in mind, this program does roll out in just 2 weeks. Live at Hell's Kitchen, I'm Gus Rosendale, News 4 New York.
Okay, there you go on that video and that report. And that does it for this morning edition of your morning news update right here on the Riley King Radio Network. I hope you all have a great rest of your day. Thank you for tuning in and listening, and see you back here later on today for another news update. Goodbye, everyone.